Hello everyone, today we'll explore how diagnostic inequity affects women with PCOS and how we can use cutting-edge technology, more specifically machine learning, in order to overcome these challenges. Imagine waking up each day feeling trapped in a body that seems to work against you. Your face and body sprout thick dark hairs in places they shouldn't, while your skin battles relentless painful acne that never seems to heal. But most heartbreaking of all is the quiet, ever-present fear that this body, which feels so out of your control, may one day prevent you from experiencing the profound joy of motherhood, the one thing that you've always longed for. Now, what I've just described is the reality for many women living with polycystic ovary syndrome, or PCOS. Now, my assumptions are that most of you would have not heard of the disease PCOS, but in fact, it affects around 11.5% of the world population and across all continents too. A meta-analysis conducted by the Archives of Gynecology and Obstetrics revealed that Africa reports the highest PCOS prevalence rate at 22.7%, followed by Asia at 10.9%. Now, the scale of these figures become way more apparent when we compare them to the prevalence of perhaps more well-known diseases, such as, for instance, heart failure at 24% and diabetes at 10.5%. The three diseases that we have here are some of the most common and prevalent diseases affecting women, yet surprisingly they're oftentimes misdiagnosed. While the misdiagnosis rate for heart failure and diabetes are 16% and 20% respectively, the misdiagnosis rate for PCOS is a staggering 70%. Now, this is exactly why this presentation on PCOS matters, because diagnostic inequity is particularly problematic for PCOS. So, what exactly is PCOS? Well, at its core, PCOS is a hormonal disorder that impacts a woman's ovaries and their ability to produce eggs. In a polycystic ovary, due to increased levels of androgen or male hormones, the follicles fail to mature properly and therefore accumulate as fluid-filled sacs called cysts. This prevents egg maturation and thus results in infertility and irregular menstrual cycles. Now, having understood PCOS, let's return to that previous figure of 70% misdiagnosis rate. Why is PCOS misdiagnosed so frequently? Well, it turns out that from the many types of PCOS, a specific category called lean PCOS reports particularly high rates of misdiagnosis. A study published by the Journal of Nursing and Women's Health reported that 80.2% of healthcare professionals possessed insufficient knowledge about lean PCOS that eventually led to difficulty in diagnosing the disease. Now, lean PCOS is a type of PCOS that reports a low body mass index and insulin resistance, thus does not exactly display the typical obese phenotype associated with PCOS in general. Now, the differences of features between lean PCOS to that of more typical PCOS result in problems when diagnosing it. Currently, there are two methods involved in diagnosing PCOS. The first is the Rotterdam criteria, which includes three categories. This is irregular ovulation, observed through perhaps a woman's menstrual cycles, hyperandrogenism, observed through elevated androgen levels from blood tests, and polycystic ovaries, observed from pelvic ultrasound images. Also, in addition to that, we use a BMI index, wherein an average PCOS patient usually has a BMI of over 30. However, these criteria don't exactly apply for diagnosing lean PCOS. For example, in lean PCOS, irregular ovulation is oftentimes intermittent, which makes it very harder to diagnose, but also lean PCOS shows borderline androgen levels, which makes it less obvious for the hyperandrogenism criteria. And for observing polycystic ovaries via ultrasound images, there are mainly two problems associated with this. A. Ultrasound images of lean PCOS do not show the typical polycystic ovary morphology, therefore it's very difficult to decipher that it is actually PCOS. But B. Doctors rarely possess sufficient knowledge about lean PCOS and ultrasound, as mentioned earlier. Now, this is exactly why we have problems with diagnosing lean PCOS. And that brings us to the end of this video. And in our next video, we'll look at how novel AI methods involve the use of CNN and GAN will actually improve diagnosis for lean PCOS.